Many may be wondering why I'm releasing a series of videos over the internet, and I'm using YouTube as my means of communication and then uploading it onto Twitter and making it available also to my friends who may be able to put it on Facebook or other forms of social media. Well, the reason is simple. I feel that I'm not getting the coverage that I would like with conventional media in Papua New Guinea. And I'm not in any way criticizing conventional media in Papua New Guinea, although I believe there is much room for improvement. I think that there has to be an effort to report on issues that concern Papua New Guineans rather than just churn out media products that are paid for and that are written and propagated as being news, when in fact there is so much more that could be reported. The state of the economy, the state of the sectors in our country, health, education, infrastructure, issues concerning matters of corruption, issues concerning matters of improvement of an economy and the way of life of a people. I don't think that I'm getting the coverage that I would like, and I know that there are certainly a lot of others who feel that way, but the media situation in Papua New Guinea is such that we can't do much about it unless we have a truly independent medium. The radios are really the only way that I've been able to communicate with the people recently. I have not been getting much coverage from the televisions or the print media, although I've been sending them press releases and information updates on what I've been doing and what I'm trying to do and my concerns. There's been some sort of an embargo, and therefore I'm making this effort to release videos online. I'm hoping that by this year, or at least next year, if I don't get it done this year, I will be able to launch a newspaper and an online facility to be able to inform my people what I'm doing, so that they are aware that I am actually working and making the best effort I can to represent them. Now, this recent discussion that I wish to have here with my people, or this information which I wish to send out there, is about an incident in Oro Province which signals the need for the national government to be concerned about our health sector. There's been much discussion and debate about the awarding of a contract to a Chinese company to distribute drugs within and throughout Papua New Guinea. And there's been so much that has been said. Learned members of the health fraternity have come out strongly opposing it, and they've voiced their concerns and reasons why. The minister and the national government have stood firm. The NEC has come out and said that they followed the right process and procedures because it was recommended by Central Supplies and Tenders Board, and we all know that Central Supplies and Tenders Board is not a very credible organization as far as I'm concerned in the distribution of any services or goods in Papua New Guinea and how those services, goods are procured and what companies are selected. I'm very much cynical and skeptical about the process, the procurement process. I feel that it is full of loopholes, and it is very much open to abuse and fraud. And I have been calling, since I was the Commissioner of Customs actually, I've been calling for that organization to be audited, for the procurement processes to be reviewed, and a proper and more transparent procurement process put in place so that credible companies can be selected, that the people of Papua New Guinea can get the goods and services that they're paying for. Now, most recently, Australia made an announcement that it was going to withdraw funding of about $38 million, which is about 70 million kina, made available by AusAid to fund health programs throughout Papua New Guinea. The Papua New Guinean government has come out strongly and said that, well, we really don't care. But I don't think we're in a position to say that unless we have put in place a health sector and a system of delivery of goods and services to our people that is effective and efficient and credible. Then we can really say, yes, we're an independent country and we can look after ourselves. At the moment, we really can't look after ourselves insofar as health is concerned. And I feel that to basically brush the situation aside and ignore it is to ignore a fundamental situation that exists in Papua New Guinea, and that is the dire need to improve the health sector. Most recently in Oro Province, a health patrol that happened to be patrolling in one of the districts exposed whooping cough. And according to their assessment, 10 people had died from between the period of September up until December from whooping cough outbreak in Kira, a district in our province, a remote district, I might add. Now, fortunately, we were able to dispatch 4 teams to that area, quarantine the area, and treat the people there and bring vital services to that area and its people. And we were able to do that because of 2 very important mechanisms that were in place. One, this year, or for this year, the Oro Provincial Executive Council budgeted for and put aside 1 million kina so that we may respond to such situations. Now, in my opinion, that was great foresight, and we have been proven right. With that money that we have set aside, we've been able to access airline services and deliver those teams to those remote areas with the drugs and the services that our people require and save lives. There was also the fact that a portion of that was funded by the AusAid program, that very program which is now being threatened by the withdrawal of such services. If we were unable to get that team out there, I believe more people would have died. Now the question here is, if Papua New Guinea is going to ignore this situation, then certainly more people will be dying. What will we be doing to ensure that such situations do not occur in this country? If we are going to do away with 70 million kina worth of health programs, then has the national government made an effort to assess those programs that are being funded, and what are the requirements, what are the mechanisms, what are the manpower, what exactly are those programs and where they are, and put in place a backup plan, a situation where we can be able to respond so that we're not entirely dependent on funding from AusAid. As it is, if we do not consider that, then we're certainly inconsiderate of the people in those areas, rural areas mainly, who depend on those services. This year we've organized to have volunteers come from Australia and other parts of the world who are going to come to Oro, immunize children and carry out various health programs, and they're doing it at their own cost with the assistance of the Oro Provincial Government. We have decided that health is perhaps the most important sector in our province, and we want to ensure that we are able to save lives and provide healthcare services and products to our people, especially in the remote and rural areas, those areas between provinces, border areas that have often been forgotten and neglected. But I want to ask the national government to conduct a thorough review of our health sector, our aid posts, our hospitals, our sectors out there that are being funded by this health program and this aid money and volunteers and so forth, and how do we put in place a system that they can continue to benefit from so that we can continue to save lives, which is the fundamental objective or purpose of any government, really. And so that is a great challenge that we have yet to overcome. After 38 years, we certainly haven't made much inroad into that sector. In fact, health services continue to deteriorate in stations and districts throughout Papua New Guinea, and people are just simply not able to access those services. Many are dying, much of which is not reported in the media, much of which the information is not making it to the relevant minister or ministers. And I would suggest and even propose that the national government is very much unaware of the true state of our health sector in Papua New Guinea. So those Papua New Guineans out there who care, those who are educated, who are able to understand what is happening and who know what is happening, should be lobbying their relevant members of parliament. I know that members of parliament are very difficult to access, especially after they get elected. Usually they're seen everywhere when you wish to elect them, and they are ready to be re-elected, but I think many of them do care. There are many members of parliament that are trying their best. It's just that we are working with a broken down machine. If this machine is broken down, then no matter how hard we make that effort to push that machine, it can only move so far. So I think it is a wake-up call for the national government, for all the provincial governments, for the members of this country, the leaders, to step up and make that effort to overhaul the health system in this country. And I think every Papua New Guinean who can make an effort to raise concern should do so through whatever means they can. I want to appeal to the media that they need to make an effort to get out there and report such situations and matters, that they need to report matters that may be controversial, that may be, that may not be promoted by the government of the day or by the powers that be. And I want the media to get out there and actually expose such situations, because we can only improve if we can expose such situations. That's my thought for this segment.